We're not far away from robots. Robots are going to be cleaning our toilets and washing our dishes maybe within the next 2 or 3 years. And I wonder whether essentially like a physical therapist, a physiotherapist will have a small little R2D2 kind of follow them round, and it will help with note taking at the start. It may help with screening them to start with. It will help with exercise prescription, and it will help with them then talking to the therapist themselves about their decision making and the current evidence that's within there. And then that robot will talk to the patient's robot at home to say, okay, I've got a rehab program that I need you to do. I'd like you to supervise the exercises, help with adherence, make sure that their form is perfect, and assess for anything that may need adjusting. And that's at that point you alert me and we bring them back in. Leo's probably got the biggest smirk on his face, so I might start with Leo to see whether this is something that I think you may think is fantasy, or whether you think it might be a reality within the next 5 years.
You really didn't warn us about this. I think bits of it will come true. I don't think it'll be the whole bit. And I think it will depend on what we're comparing to. I've been quite big on what we're comparing to, because if we're talking about people in rural and remote area that can't get access to a physiotherapist because of transport or anything like that, and I use the example of the NHS, where compared to a 6 months waiting list, patients will probably choose the AI over humans. In the next 5 years, I think if given an equivalent choice, if you can see a robot or a human physiotherapist with good human interaction and communication, I think our community will choose the human over the robot. How I see in the next 5 years will happen, I think that patients will still continue to see physiotherapists. They will use AI tools to assist. I think all physiotherapists will be doing that. The physiotherapist might take a client history. The physiotherapist will come up with a potential diagnosis after the client history, and the AI tool will come up with potential diagnosis and differential diagnosis as well. So they will together come up with a reasoning tool. Then it will do a physical assessment, which they can come up with the physical assessment together. And then after that, they will actually then come up with a diagnosis and differential diagnosis together. I still think it will be the physiotherapist, which has human oversight over the whole assessment, to apply the intervention. And then, yes, there might be monitoring from home. And how I see it, it's similar to what Darren said. I think that potentially for someone with an ankle sprain, let's say, instead of 5 or 10 face-to-face physical assessment and treatment session, it might now go to 2 or 3. But I think it's going to be a balance between the two. It's not going to be one way or the other. That's how I see it for the next 3 or 5 years.
Yeah. Great, Leo. Darren, I might jump over to you and get you to comment on my vision.
Yeah, I think a lot of your vision, most of that's already available now. Like for those that have been to trade shows like Medica, where you see all this technology, there's robotic manual therapists that are there. And if you sit down on the couch, you sort of, and have the experience, you go, yeah, it's ticking the box, but it's not going to replace a manual therapist. And I liken it to, I agree completely with Leo, where it's going to be used as an adjunct, and all those things, pre-assessment, pre-validation, the automation of communication. So making sure that your smartphone, your iPhone works into systems that are measuring technology and alerting, not only for current care, but preventative care. But the experience also lies with the practitioner. 2 years ago, down the road from one of my clinics, a robot cafe set up, and it was a robot that brought your meals out. It took your orders, brought your meals, brought your coffee to your table. It was cute, but it went out of business within 6 months, because the reason that the 4 of us would go to a cafe is actually the fact that we want to sit down, we want to enjoy each other's company, we want the barista that might take 3 times longer to make better coffee, but to deliver the customer service and know a little bit that welcoming. Randall, thanks for coming on in. This is what you ordered last week. But healthcare needs to be definitely more personalized and empower the client. And one of the things that we talked about in this government workshop over the last few days is it's great that the centralization of data can happen with all this technology, but what actually happens when the patient can see their scans and it talks about degenerative changes in the lumbar spine or an osteosarcoma? All of a sudden, the fear patterns, the the change management actually doesn't, we know that so much of what we do is not necessarily, it's about the engagement with the client. So that has to be how our profession continues to engage with tools, but not let go of tools because of this. In the same way that you might see the airport massage chairs and go and say, well, I can pay for a $3 massage chair in there, or I can pay for $150 with this amazing massage. It's not putting massage therapists out of business with those or Theraguns. The right practitioners will always come to the top, but it'll filter out the general.
Mark.
So when I think about fanciful ideas, Randall, I remind myself regularly that if someone said to me 10 years ago that force plates, which overwhelmed me at that point, would be on the way to becoming a mainstay within physiotherapy clinics, I would have laughed you out of town. So, and it's becoming a reality now. So I always tie myself back to that to prevent me from being too glass half empty. I'm not putting limits on anything at the moment with the rate that it's changing. I was all going to ask Darren how different things are from 2 years ago now to today, and I suspect it's dramatic. We probably can't project what it's going to be like in 5 years' time, like outside of being limited by your imagination, really, and the imagination of people who develop products. That's probably the other thing to consider there. There'll be a form of it, I think, and it'll be incremental. And I think to how Leo spoke, it will be a little bit system dependent. Like there are some systems that they can't solve their issues with human resources anymore. And when you run out of humans, you have to then start leaning on technology, which is why the NHS has had to go down some of these routes. So there'll be bits and pieces of it that will come. It will be, I think Darren and Leo have both mentioned, like the consumer choice is a thing as well. So your 65-year-old who's been watching movies and who's made these things scary for the last 20 years might be resistant. But the 15-year-old who's never known anything different might be like that. They expect things on demand now. Like they don't have to wait for a TV show to start at 7:30. If they want to watch it, they open up their streaming service and it plays. So there is going to be that element of consumer choice, and that opens potential for it to happen. Because if there is a market where people are open to that method of care being delivered that way, someone will have a go at it.
Thank you, everyone, for commenting on my vision. It's not my vision. It's just, it's maybe not hypothetical. I think there's definitely something that we should consider, and